Covering supporting the body through the healing phases of life and the stress phases in life, and talk on how we can support the body with proper nutrients so we can have the healing progress naturally without having healing crises. If you don't know me, my name is Becca. I'm a naturopath and I love getting to the root cause of symptoms. And one of the things I've been studying the past few years is how the body responds biologically. There is always a reason our body responds. Symptoms equals a healing phase. And so when we understand the body, that the symptoms they won't be a threat anymore. We want to welcome these symptoms because that means our body's already past the stress days, past the conflicts, past the trauma, and we are in the healing phase of the recovery when we have a symptom. And most of the time people get scared because they have a symptom and they run to the doctor. And they run to the doctor and the doctor gives them a diagnosis and puts more fear in them or gives them a label, and then they start to believe that label, and then their body responds to their belief system that they were told. You can be your own advocate for your health. So we're going to take fear out of it and embrace our body and what it does. I'm going to be talking about the two phases of life. So we have which we know, the day and night cycle. And this is daytime, we're active, and nighttime, we rest and repair. This is our normal circadian rhythm. We also know this as a two-phase cycle as the sympathetic and the parasympathetic. So the sympathetic is when the body is in fight or flight. The parasympathetic is when the body is in rest and digest and repair. Now, it cannot be in both at the same time at all. It cannot be at both at the same time. It's like putting the gas and the brake at the same time. You're not going to get anywhere. Think about it. If right now you heard a big noise outside, you jump up, you run outside, your body's biologically, symptoms are changing in the body, in your autonomic nervous system, without you even having to tell your heart to beat more. You don't have to tell your body to secrete more glycogen from the liver to bring into your bloodstream. You do not have to tell your skin to start sweating because it's really hot out. You do not have to tell the body these things. You don't have to tell the body to slow down the digestive tract because you are running. The body automatically does these things. And there's always a rhyme and reason behind a symptom. And I'm going to share with you guys a few symptoms so you can go, oh, okay, why does my body do this? And be okay with. Talk about this sympathetic and parasympathetic. So our body has a nervous system and we have it automatically does these day-night cycles all the time. When we are in a stress state, now the stress state is called the sympathetic, that fight or flight, and these have certain symptoms. Now, when we're in this conflict, this stress state, our body is more in a heightened awareness because we need to scan our surroundings to make sure that we will survive every second. It's just our primal instinct. Our thoughts are racing more and we're ruminating over the thoughts of the situation to try to figure it out, to solve the problem, and to make sure that our body is safe moving forward. So if you feel like you're always in this constant thought process or thinking, or maybe you can't even sleep at night because your body's keeping you up trying to solve a problem that's happened the day before or the week before, a month before, years before, and subconsciously the body is trying to resolve it. And during this state, a lot of different symptoms are happening in our body. It's just natural. Last week, Dr. Tracy said he had a stressful meeting and he went on a Zoom and he noticed himself all like his shoulders were up and he was tense. And then he realized, he's like, oh, I'm in a stress state. Relax. Everything, He allowed his body to get into that parasympathetic. So when we're in the stress state, think of things are contracting. Our digestive system contracts. So maybe if you're, constipated or high blood pressure, everything is contracted. You won't have any appetite, very low appetite in this stress state. Dine on a hamburger while running away from our predator, right? So our digestive system slows down. So constantly, if you feel you're constantly stressed or you have increased heart rate, elevated blood pressure, tense muscles, maybe you're clenching the jaw, you have cold hands or you're constantly cold. Anybody been there? I've been there for a couple decades. People shake my hands like, ooh, cold hands. I'm like, cold hands, warm heart. I was in constant fight or flight. My body was in like survival mode for decades. And I'm sure you probably know someone just like that. Maybe dry mouth because you're not secreting the saliva. So if you're in a stress state and you're not secreting the saliva, then you cannot digest your food very well. That's the first part of digestion is in the mouth. Brain fog, short-term memory loss, irritability, and also the hormones fluctuate as well. So before I go into the parasympathetic, I want to show you guys something because this is really, really important. When our cells, because I talked about digestion, when we first were made, when our first cell was first formed from the sperm to the egg, a burst of light. Scientists say there's a burst of light that happens. And that burst of light brings life. And all of our DNA is in that single cell. In that single cell, there's all the embryonic tissue layers. And on this tissue layer, we have the ectoderm, which is the outer layer, like our skin, the mesoderm, the inside, like our digestive tract, and the mesoderm, our muscles, and in the endoderm. So all of these are in the embryo, the cell, one cell, and then once it divides, it makes two make four make eight, and so forth. And each one of those cells hold a frequency and a vibration to know exactly what part of the body that it goes to. So everything has a certain frequency, and there's a reason why I'm saying these, because I'm going to tie it all together here shortly. So in this cell, and I printed out, this first picture is not going to make much sense, but once I flip it over, you're going to understand. So we have this first cell, and I don't know, all these, there's different tissue layer in this one cell. This down here is the brain when we have that one cell. Once the embryo forms, you know how it looks kind of like a kidney and then the tailbone kind of attaches almost to the head? Well, it's true. So we have the esophagus and then the rectum, and then it pulls apart. So this is our digestive system. It goes from, it's one long tube. When we eat food, it goes through all of our digestive tracts. So when we cannot digest something, it's the whole, we're looking at the body as a whole. So I wanted to show that to make a little bit more sense of why our body works as a unit and not just like just our throat or our stomach or our large intestine. It's all connected as a whole. And when we are in a stress state or something happens, it happens on how we perceive it, our subconscious, it happens in the brain, and it happens on the specific organ. And that's why Tracy said our emotions affect our organs, different parts of our body. They're all interconnected. And nutrition has a lot to do with the signaling to help these things to work better and to help heal and resolve it. So let's get into the parasympathetic, the healing part. Usually when we have a symptom, that's the healing part. Think about it. Have you ever bruised your leg and you're like, how did I hit my leg? I didn't even feel it. You're like, oh, I have this big bruise on my leg. Where did that come from? You didn't feel it. You're like, I don't know if I hit anything. But the bruising is the healing process. It's in the healing phase. The trauma of the hitting, the stressor of that is already over. The symptom is the bruise. If you ever lift weights, you're tearing down the muscles. A couple days later, it's called DOMS, delayed onset muscle soreness, when you're super sore, like 2 days later, not when you're lifting. That's the muscles repairing. That's a symptom. You have a runny nose. That is a symptom. During a stressful situation that you do not want to, think back primal. Think, whenever I say something, always go back to like, what would animals do? That's how I always think, like, why is the body responding this way? So when we have a runny nose, think, what just happened a few days prior? Is a situation really stinky? Did I actually create more cells in my nose so I wouldn't have to smell the situation? And then that situation is gone and over, and then bacteria comes and eats up the extra cells, and now you have a runny nose. That's our biology. So it's how our biology works. Now, I have to do a little disclaimer, because it's not always on the subconscious level. It could be malnutrition. It could be over toxicity. It's not always a subconscious conflict that we're going through. So I just wanted to disclose that. When I learned on how the nervous system and the body, the biology works, it was like the cherry on top, because I've worked with so many people like, okay, you're doing everything. You're eating right, you're exercising, you're getting your fiber, you're getting your water, you're sleeping, all of this right, you're taking out the toxins from your environment, but why do you still have these symptoms? And this happens because it's how our body perceives. I'm gonna give you another example. This is an example that's happened to me. A couple years ago, my daughter was still living at home. Her boyfriend was living with me, and he started making the rules in my house. I was not happy about that. I'm like, nuh-uh, this is my home, my territory. You do not make the rules, my house, my rules, right? So I had this little, don't like this. So I sat my daughter down, we talked about it, we resolved the situation. Kidding you not, 2 days later, I had a UTI. And I had a meeting later that evening. I was sitting on the toilet, and if you've ever had a urinary tract infection, you know how much it sucks. It stings. And I'm sitting there, I don't have cranberry juice, because first thing I think of, cranberry juice, nutrition, my nutrition background to help it. And then I go back, okay, what in the wild, what is actually happening in my body? Because it was my territory, cells started to increase to carry more urine. And then once I resolved it, then bacteria came in, eating up the cells, and that's when the burning and redness, like everything set in, is during the healing phase. And the brain is so powerful, guys, so powerful, that I said, you know what? Thank you, body. Thank you, God, for bringing this to my attention. I resolved this situation within a couple hours, 2 hours, maybe 3, completely gone. Like completely gone. The body, I resolved it. When you resolved something that you had stress, that symptom most likely will never come back. If it comes back, that means you never got to the original resolution. Like you haven't resolved it, you haven't made peace, you haven't been able to laugh about that situation at all. For example that I'm gonna give, and this is an old friend of mine. I've known her since elementary school, and we were chit-chatting on the phone, and she's like, I was telling her kind of what I do in my practice, and she's like, oh man, I've had asthma since I was a kid. When did it start? She's like, well, 12 years old, I have to use an inhaler all the time. I said, what happened? Well, her cousin scared her, jumped on her. She was scared so much, it was unexpected. She ended up peeing her pants, and it was a fright conflict that she's like, got her breath taken out. So her body, the biology, started creating more cells in the lungs. So she was, every time she had a little, maybe it was a thought or a smell or a situation, her body would have this little asthma attack. And we were just chit-chatting. I said, do you think this will ever happen to you again? And she's like, no. I said, do you know that you are safe from this situation? She goes, oh yeah, absolutely. That was like 12 years old. And I go, okay. I said, next time that you feel like you have an asthma attack, why don't you talk to your body? So she's like, next week, she didn't tell me all this stuff until like 8 months later. Following week, she had a little like asthma attack, but she's like, no, I'm safe. She didn't have to use her inhaler. 8 months later, we went out to dinner and she goes, oh, Becca, by the way, I haven't used my inhaler since last July. And that's just her being aware in her body. So that's how powerful, like God made our bodies so amazing. So let's get into the healing phase of things. So once we're in the parasympathetic, we've done with the conflict, we are in the healing phase. Usually where we have fatigue or fever, we're extra tired, headaches. Do you know anyone that has headaches all the time out of nowhere? Maybe it's a hormone shift. But what happens in a healing phase? Fluid happens, inflammation happens. We have the Restore that helps support the healing phase. When the body is in a healing phase, there's always inflammation. And what's so nice about food and not synthetic ingredients or medicine stops it. This supports the body to give it the nutrients and the ingredients for the body to continue to heal. And that's why I love the LifeWise products, because it gives the raw materials for the body to support the healing phase. So if you are in this chronic inflammation, that means you are chronic, healing from something. The Restore is absolutely amazing because it's going to support the body during this healing phase. Another thing in the parasympathetic, we know when we're sleeping, we're in the parasympathetic. That's when we're resting, repairing, is at night. The dream, also great. There's something I want to share about one of the ingredients in here, the saffron. The saffron, I work a lot with flower essence in my practice. And this is the absolutely best sleep product. Not only that, it helps with anxiety because it down regulates our nervous system to support the healing phase of it. The saffron is a flower, and flowers hold a certain frequencies. Tracy mentioned this last week, certain vibration. And each flower and herb out there that God put on this earth has a certain frequency that helps with emotional support. And that's why the saffron in here helps with our anxiety. It down regulates our anxiety so we can think more calmly. We're not anxious because we're in this heightened stress state all the time. The saffron helps because of the flower, the frequencies. Not only that, it also helps with night sweats and hot flashes as well. Night sweats and hot flashes are a healing process that's not been resolved. So people in menopause, perimenopause, you can argue with me all you want. Overtoxic, undernourished, unresolved situations. That's why you are going through that, because you didn't resolve. Did my thesis on that. So the saffron in the dream, absolutely amazing. Helps with hot flashes. It helps with anxiety. It down regulates. During these healing phases, your hands will start to become warm. You will have your appetite back. When you're sick, sometimes feed a cold, starve a fever. That's what it is, right? Your GI tract starts to relax now. So if you're someone who struggles between constipation and diarrhea all the time, that could mean a lot of things. Overgrowth in bacteria, you're not chewing your food right, you don't have enough hydrochloric acid, you're constantly in this fight or flight all the time. We need to support the body with whole food nutrients, and Rob read all the main ingredients in here. It's full chock full of all the nutrients our body needs for signaling. Most supplements out there are vitamins. They're synthetic, a shell. They don't have the cofactors that send the signals for your body to do its thing. Likewise, it's whole food. It has all the ingredients that alfalfa has, all the vitamins and minerals that it has. It's not just taking out the vitamin C, the ascorbic acid. It has all the cofactors to do its job to support the body during the healing phase. Every time that you're in a stress state, it could be stress from job, stress from working out, stress from environment, stress from not getting enough sleep, stress from an injury. All of those are stresses that the body, goes through. We go through stress, but the body is not meant to stay in stress. When we go through a stress state, our body uses more nutrients, more minerals to use to heal the body. If you are depleted in your nutrients, your body is not going to be able to heal properly. And it's going to take you longer. It's going to take you longer to heal from any injury. It's going to take you longer to heal from a sickness. It's going to take you longer to resolve you're going to be in that stress state. If you ever notice how taking the one also can calm you down. It calms your digestive system down. It allows you to digest your food. The brain and gut work together. So we're in this, the body works as a whole, not as an individual. As we saw in this little picture, it's a whole, how our body works. So if you have any other questions, feel free to reach out. Supporting the body, not only during stressful situations, but during the healing, always remember, healing, most of the time, the symptom is a healing process. So don't be afraid if you have a symptom of some sort. Tell your body, thank you for letting me know about this. There is always a reason the body is going through that symptom. If our blood sugar is through the roof all the time, that means you're a constant fight or flight. Or you could be snacking all day and eating crap, If your blood pressure is through the roof, that means you're vasoconstrict, you're in this tight, you're not giving the nutrients, the phytoplankton, the greens to allow the cells to pull apart and be plumped and carry the oxygens through the cell. So we need good whole food nutrients to support our body because it's on the cellular level. Your cells is only as healthy as the environment that it sits in. And then healthy environment, healthy cells, healthy cells, healthy organs, healthy systems, healthy body. Understanding how our body works in both stages and, take the one. That is the foundation that everybody should be on because it fills in all the gaps.